Hello, I'm Jonathan Nelson with the Texas Academy of Family Physicians, and this is your Capitol Report. With only a few weeks left in the 83rd Texas Legislature, TAFP's legislative agenda is in great shape. Most of our efforts have focused on the state budget, where restoration of funding for graduate medical education, women's health, mental health, and physician education loan repayment are top priorities. Last session, lawmakers cut state funding for graduate medical education by 44%, and they cut a source of support for family medicine residency programs administered by the Higher Education Coordinating Board by 74%. Dr. Sam Wang is the Associate Director at Memorial Family Medicine Residency Program in Sugar Land. He says the past couple of years have been tough for the program.
Well, it definitely put a large strain in the budget for our program. It cut out a substantial amount of money that the sponsoring organization then had to cover. So it really put a huge dent in the cost or in the funding for our program to the tune of about $500,000.
This session, TAFP has argued for increased funding for family medicine residency training so the state's 29 family medicine residency programs can continue to produce the primary care workforce Texas needs.
Various parts of the state of Texas, there is a very significant shortage in primary care physicians, and I think we do need to make sure that we have adequate training spots for all the medical students that are being produced by medical schools in the state of Texas. And it would be a shame to let that investment get away if we don't have enough slots to train medical students once they graduated from medical school.
The House budget increases spending on family medicine residency training by $8.5 million, bringing the total up from $5.6 million to $14.1 million. The Senate would spend about $2.7 million less. A conference committee made up of budget writers from the House and the Senate has begun negotiations to hammer out such differences between the two bills. TAFP will continue to argue for increased support for family medicine residency training throughout the rest of the session. Women's health care in Texas has been in crisis since the legislature slashed funding for a series of programs last session. But good news may be just a few weeks away. For more, here's TAFP's Samantha White.
Because of last session's cuts, 147,000 women across Texas lost access to preventive cancer screenings and contraception, and at least 53 clinics have closed. Last fall, a concerned group of public policy, faith-based, and healthcare organizations formed the Texas Women's Healthcare Coalition, led by TAFP member Dr. Janet Riolini. Thanks to the coalition's efforts and legislative champions like Representatives Sarah Davis of Houston, Donna Howard of Austin, and Dr. John Zerwas of Simonton, the legislature is poised to restore women's health funding. The House appropriated $246.6 million for these services, while the Senate would spend $32.1 million less. The coalition and TAFP are urging the Budget Conference Committee to adopt the House spending levels to restore health care access to those women who lost it. For TAFP News, I'm Samantha White.
The Senate recently passed a bill that would boost production of primary care physicians and increase the number of medical residents training in Texas. Senate Bill 143 by Senator Jane Nelson of Flower Mound establishes a couple of new grant programs to increase the number of residency training positions in the state, and it creates incentives for medical schools that produce more primary care physicians. TAFP President-elect Claire Hawkins says after the cuts of last session, this is a welcome bill.
When you reduce funding at the graduate medical education level, those people who are going into residency, what happens is you've already spent an investment in medical students who then decide to leave the state to get their residency training somewhere else. And it's a net loss to the state of Texas. Whereas money spent on graduate medical education almost definitely keeps more people within the state to become part of the medical workforce.
After cutting almost all funding from the Physician Education Loan Repayment Program last session, the legislature has resurrected the program by investing $35 million over the next 2 years. That's enough to cover educational loans for more than 200 doctors who promise to practice for 4 years in health professional shortage areas or who treat a certain number of Medicaid patients and patients in the Texas Women's Health Program. And finally, I'd like to invite you to join your friends and colleagues at TAFP's 64th Annual Session in Scientific Assembly, July 31st through August 4th in Fort Worth. Visit the Professional Development page of TAFP's website for more information and to register for the conference. I hope to see you there. For more in-depth coverage of these and other issues important to the family physicians of Texas, check out the news section of TAFP's website, tafp.org, and be sure to watch your email inbox for our next edition of TAFP News Now. Thanks for watching TAFP's Capitol Report. I'm Jonathan Nelson. We'll see you next time.